Hi, I'm Dr. Binyamin Rothstein.
And I'm Fred.
We're here today to talk to you about why the pain won't go away in your back. Low back pain. Many people suffer from low back pain for many reasons. Now, first, let's understand what low back pain is. It's not just about pain hurting you in your back. There's many aspects to your back. You have the front of the back, and you have the back of the back. See, the front of the back and the back of the back have muscles holding the back up, like guy wires holding a radio tower up. Muscles going from down the spine to the pelvis, down to the sacrum, from the ribs down to the pelvic crest, the front of the spine, the psoas muscles, the iliacus muscles. All these muscles are pulling to hold the body up straight. And you'll also notice that the spine is curved. It's not meant to be straight. It's supposed to have a curve to help absorb shock. Speaking of absorbing shock, between the vertebrae, right? These are the vertebrae, these are the bones of the vertebrae. Between them is this thing here, the disc. It's a cushioning. It's a bushing that keeps the shock from drawing the bones too much. In addition to the curve of the spine, these discs help absorb the shock so you don't have as much pain, you have more mobility. In addition to that, you have on the side of the spine here, these are the nerves come out of the spine, these little holes right here called this is the facets, and these are the holes the nerves come out. These areas here is where a lot of times nerves get trapped by inflammation or muscle spasms and pinch the nerves, shooting pain into your back and lower extremities. There's many aspects of the back. Look over here. It's also interesting. These facet joints, the joints for the spine, each vertebrae connects to the other vertebrae, called facet joints. They're fascinating joints. They're very small. They're small, but they're very powerful, very strong joints. And within the joints themselves, there's delicate nerves that are sensing what goes on in the spine. Are you upright? Are you slouching? And does it hurt? You know, sometimes when you slouch, it hurts more. When you sit up straight, it feels better. Because the pressure comes off those nerves between the facets right in there. It feels better that way. In addition to that, when your posture is good, the foramina, that means the holes, where the nerves come out, increases the size when you sit up straight. So good posture takes the pressure off those nerves. In addition, good muscle tone in the back and the front of the spine keeps the body straight, mobile, and keeps the pressure off the nerves. Again, you're going to feel better. In addition to that, when you have good proper alignment, all the ligaments holding things together, the whole back together, all of them are more balanced and more relaxed. Less pain, less irritation to the nerves. So many aspects of our back come into play when it comes to chronic back pain. Something else a lot of folks don't realize is that the intestines that fill this cavity called the abdomen, this abdomen filled with intestines, 30-some feet of intestines, your gut's just twisting, winding around. When they get tense and pressure, get a little upset, get a little stressed, your bowels, you get like a irritation in your belly, butterflies in your stomach sometimes. That's actually the nerves making your intestines kind of spasm up. And when the intestines spasm up, guess where the pain goes to? Guess where you feel it? You got it. You feel it in your back. So the back pain has many, many causes. Tension, problems in your intestinal tract, spasms in the back, irritation to the nerve, arthritis that distorts the facet joints. The bones, sometimes they crumble. People who unfortunately experience compression fractures as they get older from osteoporosis. The vertebrae crunch down, distorting the natural curve of the spine. That also causes back pain. And of course there are, God forbid, things like cancer and tumors that affect the spine itself, hurts that too. Poor circulation to the spine can cause back pain. Did you know that jaw pain can cause back pain? Tension in the jaw, right here, called the TMJ, the temporomandibular joint, actually causes tension that goes to the back of the neck, all the way down the back, and all the way down to the low back. You can have low back pain as a result of TMJ, temporomandibular joint dysfunction. Knee problems, muscles from the leg and the lower extremity, where they all connect to the pelvis and low back. If you're limping, you got a problem in your leg or your knee, you can have problems in your low back, and vice versa. So low back pain is not just about a simple question about my back hurts. What's causing the low back pain to begin with? And that's the most important job of a doctor, discovering and diagnosing what is causing the problem. Once you know the cause of the problem, you really go all the way down to the real source of the problem, then you can treat it. And it stays away. It gets better and it stays better. So if you want to have relief of your low back pain, first you must have a diagnosis of why it hurts in the first place. If you know why it hurts, then you can know what to do to fix it. And so the first thing you do, we got to find out why your back hurts. Now, I'm going to tell you something about back pains. One other thing, a lot of times doctors order MRIs and CT scans of your low back. It turns out those tests are really quite unreliable. Once in a while, there's a very severely ruptured disc in the low back that's pushing the nerve so badly that the only recourse is surgery. That's a very, very rare event. A couple years ago, I spoke to someone, a neurosurgeon. I had a patient we were dealing with, we're sharing, and I'm talking about back surgery. He said, let me tell you something, he said to me. And this is not going to believe what he said. He said to me, I do more back surgeries than anyone else in the country, he told me. Hundreds of them he does a year, 500, 600 a year of back surgeries. He says, I don't believe in them. Because in the vast majority of cases, back surgeries are not necessary. Exercise, stress management, alignment, nutrition, all these things play a major role in relieving back pain. Sometimes specialized injections to get the facets so they're not so irritated. Sometimes scars. When the scars heal, they pull on the tissue and create pain someplace else in the body. There's many reasons for back pain. And I'll say it again, the most important thing to do is to find out why does the back hurt in the first place. If you know why it hurts, then you know how to fix it. And the first thing I do with a patient, I spend a lot of time. I want to know, why is your back hurting? It's not just a simple problem. Sometimes it is, but oftentimes it's not. Until we know what the problem really is all about, you can't get well. And the proof is, most folks don't get well from their back pain. It comes and it comes and it comes over and over. They spend their whole life chasing their back pain. Back braces and magnets and acupuncture and exercise and physical therapy and chiropractic and medications and eventually surgery. And all said and done, they're still hurting. Why? Because you didn't make the right diagnosis. What's really going on in the back? Why does the back hurt so much? What happened? What was going on when it first appeared? How did it first appear? Were you sleeping? Were you lifting? Were you throwing? Were you falling? Were you screaming? Were you crying? What was going on if back pain first happened? So we have to find out what's going on with your back. I'm Dr. Binyamin Rothstein. I'm Fred. Thank you for visiting. Wishing you the best in health and longevity.